Going to go ahead and get started here. Again, thanks everyone for joining us here today. We're going to be talking about HIPAA-Safe communications. Before we hand it over to Jim Johnson, a couple of housekeeping things. We're going to keep all of the phone lines muted during the webinar today. We are going to pause at the end, however, for questions. So if you think of questions or if you have questions as we go, please use the question panel there on the GoToWebinar little control panel, and we'll address those towards the end. As always, we'll be recording this session, and all of you attending will share the materials in the recording after. I want to take a moment here and just introduce our speaker, Jim Johnson of Live Compliance. Jim has joined us on several of these webinars in the past. But for those of you maybe new to us or Jim, we, Medical Advantage Group, formed a partnership with Jim's company, Live Compliance, about a year ago now, just based on demand and interest we were seeing from our clients. We've been working with Jim's company, who's been helping many of our practices throughout Michigan and Ohio with their HIPAA compliance needs and audit readiness, etc. We've done, as I mentioned, many of these webinars with Jim over time. The feedback is always exceptional. I think you'll find Jim to be just a fantastic, very knowledgeable resource in this area. And we're in for another great session here this morning. So with that, Jim, we'll swing the control over to you, and you can take it away.
Okay, excellent. Let's make sure my screen is showing up. Hopefully everyone can see my screen. Bill, is that showing up for you?
Yeah, we can see it just fine.
Okay, excellent. Well, thank you very much, and it's really great to see so many folks joining us on this webinar. This is certainly a very hot topic. We get asked about this quite a bit, and hopefully you'll find quite a bit of value in what we're going to share today. And my goal is to not only share from an education standpoint, to maybe make you aware of some things that maybe you just didn't realize, help you understand some things that you can put into practice right away, and hopefully some of the takeaways that you'll also find from this are actionable in a way that will help you ensure that you don't inadvertently breach or improperly disclose protected health information. I know that sounds maybe a bit confusing, but really what you have to do, and where we're going to start, is how you can communicate and what you have to do to ensure that even though you're communicating using very modern tools today, that you do it in a way that doesn't improperly disclose patients' information. And that's what we're going to dive into now. So I know we're going to cover quite a bit. I'm going to move through some of this maybe at a bit of a faster pace, but that's okay. Put your questions in there, excuse me, and we're happy to answer all of your questions. So feel free to let us know if you want us to cover something a little more in depth. Okay, so first screen here. What are today's typical communications? This is what we find in most practices. This is where we find a lot of breaches. If you visit the CMS wall of shame, you will see a lot of improper disclosures that have to do with these type of communications. So we're going to focus on email. Obviously, email communications, everybody has emails, but gosh, there's a lot out there that causes problems with email. So we're going to talk about that. Text messaging. Everyone loves texting. It's a really great way to quickly communicate with people. We know that it's also a really easy way to send pictures. And boy, that could be a real help in the medical industry, to be able to share a picture or something like that with someone very quickly and easily. But there's a lot of problems that go along with texting and communicating through text that we're going to talk about. Social media. This is a big one. Boy, with so many different social media platforms out there, how does this pertain? And how can you safeguard information when it comes to social media? A lot of docs that we deal with, a lot of practices that we deal with, they think, well, we don't do anything on social media. No one's going to use that. And then when we start talking about it, they're like, oh, yeah, we do. We do actually do that. And, oh, yeah, we do this. So we're going to touch on some of those things also. And most of you out there who have adopted an EHR or maybe have found yourself changing EHRs and you've dealt with your patient portals, certainly anyone who's attested for meaningful use knows about the core measures for the requirements of sending a message. So we're going to talk a little bit about, too, what's involved in patient portals, what the usage is, and how that all works for messaging. Okay, so let's dive right into the email communications. So email must be encrypted. Now, Health and Human Services and the Office for Civil Rights, who governs HIPAA and who has the federal rules surrounding HIPAA, says that encryption is best practice and recommended. There isn't anything that says it must be encrypted when it comes to Health and Human Services, but I would caution you that there are some caveats that go with that. First of all, if you do say, well, there's no rule that says I have to encrypt this, well, you do have to educate your patient on the risks of not encrypting their messages. I don't know anybody who wants to take on that. I don't know anybody who wants to really deal with trying to educate their patients on the risks and you know, where would you even get started with something like that? So right off the bat, I think the best practice and best rule is do not send any email that is not encrypted. Now, to some, that's going to be pretty obvious. Okay, great. We can encrypt our messages. But what is the difference between secure and encrypted? And are you certain that when you think you're sending an encrypted message, it is in fact encrypted? Let's just pick on Gmail or Outlook. A lot of people out there are using Office 365 for their email. It's pretty typical stuff. And when you log in to your email, it says in your address bar, it says secure. You see the nice green little lock in your web browser, whichever browser you're using. You know, that's secure. Very, very different between that and encrypted. Secure basically means that you have successfully authenticated both you as the end user and the system that you've authenticated to. Okay, so what that really means in simple terms is you, the user, put in your username and your password for your email, for Gmail, let's just say, and you have connected with Gmail's system. That's what secure means. That gives you the knowledge, that gives you the verification that you are truly communicating with that system and you haven't been hijacked or you haven't been routed improperly to some other system. That's what that secure piece means. That is not the same thing as encrypted. Encrypted means that that message is absolutely unreadable unless you have the decryption key, unless you can unscramble that message with the pre-shared keys for encryption. Now, a lot of this happens under the hood. You as the end user really don't deal with a lot of that, but it's very important to understand that if you send an encrypted message, what actually is happening is the text, the content, the images, the PDFs, whatever is included in your email is not readable unless somebody else logs in and can authenticate as that user. So how that happens is, a lot of times you've probably seen this in banking. Let's say you get your bank statement. They don't email you your bank statement. What happens is you get an email that says there's a message for you with a link. And when you click that link, it opens up and causes you to have to authenticate as you, meaning username, password, two-step authentication, maybe even some other verifiable information to help verify that that is in fact you. And then once you open that message, it's not actually in your email anymore. What you'll notice is you've clicked that link which came to you in an email, but now you open it in another system. And that email remains, you've probably heard this, in transit and at rest, encrypted. That's the safe way to do it. Anything else is what's called, you might have heard this term, called clear text, meaning you can have ransomware, man-in-the-middle attack. You can have somebody who just isn't authorized to view your messages be able to access those messages. So that's why encryption is very, very important, and that's why secure versus encrypted needs to be in your education of your practice and in your processes of how you send messages. Don't just rely on, yes, this is secure, because that's not the same thing as encrypted. One of the other big areas of email that we see is a problem, and that is your emergency mode of operations. As a practice, you have to have that in place, but also charting. So a lot of times we see the documentation trail and the audit trails that are required be broken. What happens if you have all of your staff sending email messages outside of your normal documentation process, which would probably be, your EHR, maybe through your patient portal, maybe you have some other documentation processes if somebody comes in the office and gives you paperwork. But if you have email communications that are being sent out through maybe your workforce, maybe from the doctor, how are those messages being collected and saved within that chart? And that's going to go towards your emergency mode of operations. And how that ties into that is, what happens if email communications, even though they're encrypted and even though it's safe, let's assume that, if there is discussions between the provider and the patient, and that never makes it into the chart, and then there's an emergency situation, and that information isn't taken into account because it lives in an email system. So you have to be very careful when it comes to email communications from the perspective of encryption, making sure that it's secure and safe, making sure that your workforce is knowledgeable on what your policies and procedures are, and how to make sure that that gets into the chart and into the information for that patient. All of this comes back to HIPAA. HIPAA compliance governs and talks about all of these areas that we've just mentioned when it comes to email communications. Okay, so the next one we're going to talk about, which also is a big one, is very, very big. A lot of folks out there are really enjoying the benefits of all of these smartphones and the power that they have and the ease of use. Texting, text messages. You can get a text message on your phone. You can get text messages right on your computer, which synchronizes up with your iPads and all of these remote, different modalities, all of these different technologies that are very readily available. So what's the problem when it comes to HIPAA and utilizing all of this? Well, here's some of the big concerns. Some of the biggest concerns with text messaging is authentication isn't verifiable. So if a doc was to text my phone number, as an example, you could know that it went to that phone number, but you don't know who the recipient of that is. And that is a clear HIPAA situation. What I mean by that is, what happens if a phone number changes? What happens if my phone is sitting on my desk and somebody sees that message pop up on the screen and it has medical information on it? That's an improper disclosure. That's a breach of your protected health information, personally identifiable information. You don't know who got that message. You as a provider, you as a practice, if you text people, you have no way of knowing if the correct person received and viewed that message. So it's very important to understand that authentication is paramount in making sure that you're communicating with the right person. Now, that doesn't mean that you can't send a text to somebody with, I don't know, your fax number. You know, if somebody says, hey, what's the fax number of the practice? Okay, great. That's not considered protected health information, obviously. What would be a challenge, though, is where do you draw that line? Where do you govern that? And that's going to come down to your policies and procedures and educating your workforce on what's acceptable and what's not, especially for practices to deal with what are called your termination procedures. What happens if workforce members or even docs, what happens if a doc leaves your practice and he's texting? That's not now going to be part of the record. It's clear text. It's improper disclosure. So be very, very cautious when it comes to texting. I talked a little bit about the charting and documentation. Also, texting is not, again, encrypted. The information that is sent is plain text. There's no way that you can decrypt that information just using standard text. So what's the solution? The solution when it comes to texting is have actionable policies and procedures. What actionable means is don't just find or craft a policy and a procedure that you feel is going to meet the requirements under HIPAA, but take it to the next step, and that is ensure that it's actionable in a way that workforce members can know if somebody texts me or requests to be able to text, or a surgical patient wants to be able to text a photo of their wound or something like this. What are the processes? What are the responses for your workforce members to deal with that? How is this information logged? That's what it means by actionable. The other thing is make sure that it's encrypted. You can get apps. There's many, many free apps out there. You don't have to sign up for services, but there's many encrypted texting apps. Certainly consult with an expert, your IT staff. We could certainly help you, but understand before you just go sign up for an app that you download, from the Google Play Store or iTunes. Make sure that you know that it would pass in an audit, because you're going to be responsible for that improper disclosure. You as a covered entity need to report every improper disclosure annually. Okay, I'm going to pause for just a moment and let's take a poll question. Let's see how many folks out there have educated your entire workforce. There's the key word, your entire workforce, on your email and texting policies and procedures. Looks like there's a bunch of folks logging in. Have you educated everybody in your group? This is important because the Office for Civil Rights has really made it clear that HIPAA is no longer a binder on the shelf, and they also say very clearly, your workforce is your first line of defense in protecting health information. So very, very important. Excellent. Okay. Yeah, so it looks like, gosh, a little bit more than half of the folks on this call have taken the steps to educate their workforce. Now, that's fantastic. I actually am impressed to see that more than half of the folks on this call have done such education. What I would add to even those folks who feel that they're doing some education, keep up with the technology, right? It's always changing. There's always new apps, new easier ways to do things, and gosh, while that technology is just great and helps in so many ways, you also have to keep up with it. So be mindful of any changes in the technology. Okay, so we're going to move on to the next topic, which is social media communication. We hear a lot of practices say, nope, we don't do anything on social media, just want to stay away from it. But then they realize that really they are involved in social media, and maybe they don't even realize it. We see many situations in our business over the past several years where social media is really becoming more and more tied into businesses, where improper disclosure happens inadvertently. Two things that come to mind is a situation where somebody in an office using their smartphone takes a selfie picture, and in the background there's medical information. So that just got posted out for everybody to see. That's an improper disclosure. That's a big problem. Then you have things out there, social networks. I just put a couple of them here on this screen, Yelp, Facebook. There's also a lot of websites out there that allow for people, patients, to put their experience with their provider, rate your doctor, right? Very, very powerful thing from a business perspective, but we have also seen many situations where a patient could go out on a site and say, wasn't happy with Dr. ABC, or wasn't pleased with this, that, or the other. And then the first reaction is to respond and say, well, this patient wasn't compliant. They came in the office and, this, that, or the other. Well, now all of a sudden you just thought you were protecting your business, but you just improperly disclosed their health information. And many times those comments cannot be removed. So it makes it very challenging to understand and educate your docs, your business managers, and even some of these companies that are easily hired to manage your social footprint, making sure that your business is out there and available, making sure that they understand what is in disclosure and what should and shouldn't be listed. What to avoid? What to avoid is responding to comments and information. If somebody was to post something on one of these sites, if somebody was to put something like on Yelp or something like that, take the conversation offline. Simply, maybe respond with, give our office a call or something like that. Don't respond and put yourself in a breach situation that then causes you to be audited, fined, listed on the CMS wall of shame, and all of the other difficulties that come along with something like that. So social media, even if you feel that, gosh, we really don't do anything on that, be mindful of a lot of these websites that give patients the opportunity to post information about you and making sure that you don't respond. Hopefully that makes sense. If there's any questions about that one, which there typically are, definitely feel free to post those. We're happy to expand on that. Okay, moving towards the end here, patient portals and the usage of messaging through patient portals. Now, I know there are a lot of challenges, and we hear all the time from practices that sometimes patient portals are a bit difficult, hard to get patients to go to those, use them, but there are some benefits. And I did want to point out some of the pluses surrounding patient portals, and that is documentation. By using the patient portal, it's bringing that messaging and that information right into the chart. So it makes it easy for other docs or other providers, maybe in a situation where it's not just a one provider practice, to also see that thread of messaging and communication. So patient portals really help with documentation. Of course, clinical measures, a lot of you will remember the meaningful use requirements around messaging through your EHR. Security and analytics, though, are huge. Security goes back to that encryption. Your electronic health record systems all have to do their own risk assessments at a minimum of once per year. In addition to the risk assessments that you are responsible for doing, this really is going to help in covering any vulnerabilities or gaps. It gives you the ability to see analytics, see who is communicating with you, how those communications are happening to keep you from improperly disclosing information outside and not even realizing that some of your patients are communicating through this media. Some of them are communicating through email and other media. It keeps it very clean so you can see those analytics. Of course, encryption and audit logs. We've talked about encryption quite a bit, but the audit logs are important as well, because how do you know if you've had an improper disclosure if you're not tracking where your protected health information is and where it has been, right? So if you send an email, and I'll just pick on plain email, although we've talked about don't do that, so hopefully most of you will not. But let's just say if you have sent this out, how would you know if it was improperly disclosed? How would you defend if you were involved in being accused of improperly disclosing someone's information? You would have no audit trail. You would have no ability to show that the information is secure. And one of the nice things about using your patient portal is you would have those audit logs. So you can see if there was a breach, and you can see if there was any information viewed or improperly viewed by somebody. So patient portals are very useful. I know sometimes they can be challenging to train and get folks to understand and adopt and use. But with everything, there is some training that comes along with it. But there are some very strong benefits as well. Okay, in conclusion, wrapping up, policies and procedures. That would be the number one thing that I hope you have as a takeaway from this, and that is make sure that you have your policies and procedures in place, not just a binder on the shelf that's just there and says HIPAA up the spine of the binder. That's not going to cut it. You have to have actionable policies and procedures that help not only know what the policies of the organization is, but what are the procedures? What happens in their talked about on this webinar? What are your workforce members to do? What are the docs supposed to do? What happens when there's new technology adopted? Are those policies and procedures updated? And keep in mind, again, your workforce is your first line of defense. So making sure that your workforce is educated and knows how to handle these type of situations is imperative. You can have the best documentation, but if that's not being used in practice, it really doesn't matter. And we've also talked a bit about making sure actionable, making sure that these documents are useful. What happens if someone's terminated? How do you take away those access rights to a lot of this communications? What happens if email is encrypted, but nobody has the decryption key except one person in the practice? What happens if somebody needs access to that while that person isn't there? That's what I mean by actionable. Make sure that you take those steps to document this before there's a problem. Okay, and lastly, we could certainly help. Medical Advantage Group and Live Compliance have really partnered together in really making it easy for your practices to do something about this. I know a lot of this could be very confusing to folks, but really the first step is do an organization assessment. Take a look at what you're doing, take a look at how you're doing it, and that's where you have to start in understanding what your vulnerabilities and what your liabilities are is an organization assessment. Next, by ensuring those processes and documentation are correct and in place, that's very important to make sure that moving forward you have the good foundation for adopting new technologies and ensuring that you are protecting that information. And last is training and monitoring. Make sure that you educate your staff and that you monitor changes. Make sure you keep up with any new technologies and those audit trails so that if you are audited or you do have an improper disclosure and you have to defend against whether you did or didn't improperly disclose information, that comes from your audit trails. Very, very important. Okay, so in closing, Bill, if there's any questions or anything that we can help with, I think I'll turn it back over to you.
Very good. Thank you, Jim. Great job, as always. There were a couple questions that came in. A few people asked, and I'll just confirm again, after our session today, if not later this afternoon, maybe tomorrow morning, we will be sharing a copy of all the Jim's presentation materials as well as a recording of this session, so please stay tuned for that. Jim, there was another question related to the use of text and email, and what advice would you give to a practice if they have been using text and email already?
Okay, so yeah, so if you're, learning some new things on this, or you're implementing a compliance program, and you look back and say, well, gosh, we've actually been sending out emails, and this is a problem. Document this. Save those emails. Make sure you get those email communications in the chart. Very easy to print an email as a PDF and then add that to the chart. You need that for documentation. I would also make sure that the practice of whatever you've been doing, whether email or text or both, you immediately educate your staff, put those policies in place, and ensure that there is a monumented point in time that you've adopted a new practice. Because if there is any breaches or improper disclosure, you really need to focus on documentation. That's very, very important.
Okay, very good. So we're a little bit past the top of the hour. I'm just going to wrap up quickly here. If you just go to the next slide real quick. If any of you are interested, a lot more information is available if you just go to the link that we put at the bottom of the slide, livecompliance.com/medadgroup. There's a bunch more information available. And then finally, if you'd like to talk to us, both Jim's information as well as mine is listed here. So once again, thank you all for joining us here on our latest webinar. We look forward to seeing you again at future sessions, and have a great rest of the day. Thank you.